Welcome back. In the last couple of years, especially post-COVID, we have seen the young and fit succumb to heart ailments. 24 hours ago, legendary basketball player LeBron James' 18-year-old son fell unconscious after a sudden cardiac arrest. He's a basketball player himself and was practicing when it happened. All of a sudden, without warning, he's currently in ICU. Closer home, IIM Bangalore was in for a shock this week. A 27-year-old second-year MBA student suddenly collapsed outside his class. Before anyone could realize what was happening, Ayush Gupta was dead. He had suffered something most of us don't talk about enough: a sudden cardiac arrest, a situation where the heart abruptly stops beating, leading to a loss of blood supply to the brain and to other vital organs as well. Ayush was dead in exactly 8 minutes. This is a young man who didn't have any pre-existing illnesses that he knew of. This is a young IIM student who is an overachiever, first cracking BITS Pilani and then IIM Bangalore. If you remember, last year singer KK2 had died because of a sudden cardiac arrest. Again, it had come without a warning as he was performing on stage. A sudden cardiac arrest is not a heart attack. Sushmita Sen had suffered the latter this year, a heart attack. These are two different heart conditions. While a heart attack is caused by a blockage of the artery, a sudden cardiac arrest is not caused by a blockage. A cardiac arrest happens when the heart abruptly stops pumping blood and loses all activity due to an irregular heart rhythm or electrical impulse. In the first few minutes, the blood supply to the brain is stopped, and within 8 minutes, all major organs shut down. A heart attack may sometimes lead to a cardiac arrest. One of the top reasons normal people are suffering from sudden cardiac arrest is a genetic condition called hypertrophic cardiomyopathy. This is a rare genetic disorder that thickens the heart muscle, which as a consequence cannot pump the required amount of oxygenated blood. Comorbid factors like obesity, a sedentary lifestyle, diabetes, cholesterol, and high blood pressure may aggravate this risk. Ladies and gentlemen, about a decade ago, a person under the age of 40 coming to the emergency room with a heart issue was very rare, once in a blue moon. But today, 1 in every 5 heart patients are under the age of 40. People in their 20s and early 30s are becoming more and more vulnerable to heart ailments. Between 2000 and 2016, this age group has seen a 2% annual increase in cases of heart attacks. In fact, heart attacks in people under 40 has doubled in the last 2 decades. Out of the total deaths India reported for people in the 20 to 69 age group, 25% deaths, almost 1/4 of the deaths, were due to heart attacks. Of course, comorbidity is a primary cause of heart diseases. But apart from mostly comorbid reasons, there are other chronic diseases that put a person on the highest spectrum of risk of getting a heart disease. Arthritis, back problems, asthma, and other respiratory diseases can increase the possibility of a heart attack and further a sudden cardiac arrest. Another study has shown that people with migraines are 2 times as likely to get heart attacks. Women who have had a miscarriage or have had their uteruses removed too are also more likely to get a heart disease. And if you have ADHD, watch out on those medications because they too are likely to increase blood pressure and cause heart problems. Stress and lack of sleep can also increase this risk, while anxiety can interfere with normal heart functions and increase the risk of sudden cardiac arrests. And then, of course, there is COVID. Initial studies have shown that the virus causes inflammation of tissues and blood clots which can cause blockages in the arteries and heart failure. So even younger individuals with no underlying health conditions are at risk of developing long-term health complications. Dr. Ashok Seth is one of India's best-known cardiologists. He's a Padma Bhushan. He's chairman of the Fortis Escorts Heart Institute as well. Dr. Seth, thank you first of all very much for your time here on Mirror Now. If you go on social media right now, there is a sense of shock at what has happened in IIM Bangalore. This is a young 27-year-old who suddenly collapses outside his class, and within 8 minutes he's dead. And what we are told by authorities is that he suffered a sudden cardiac arrest. What happened?
Yes,
How can someone as young as 27 get a sudden cardiac arrest?
Yeah, that's extremely sad. Of course, such news are always truly make us all sad, and our condolences to the family. I must say that right in the beginning of your introduction, you have been very scientific and extremely informative to all about differentiating between cardiac arrest, sudden cardiac death, and a heart attack. Yes, when it happens in a young person, less than age 35, often it's not just a heart attack. Often it's not just blocked artery, which immediately a cardiac arrest brings to mind, because some of the common causes in young people are structural abnormalities of the heart. And you mentioned hypertrophic cardiomyopathy, which is one of the conditions in when heart muscle gets thick. It's one of the causes of sudden cardiac arrest. There are conditions of inflammation of the heart, myocarditis or cardiomyopathy. You mentioned COVID. That actually used to cause myocarditis, inflammation of the heart muscle, leading to irregular heartbeat and sudden cardiac arrest. In fact, life-threatening heart diseases. There are conditions which people are born with in which there's irregular heartbeats, so extremely fast heartbeats can come all of a sudden and lead to sudden cardiac deaths. In fact, a history of sudden cardiac death in a family becomes a very important factor in investigating any young individual, whether he has these conditions passed down, because these are usually hereditary conditions of sudden cardiac arrest. One of the things that we must understand is that, yes, blocked arteries and heart attacks, which are usually rarer in the young in the West, are commonly increasing in India. And you mentioned that very clearly, the number of times that it's multiplied over the last few years. And when we talk about some of these sudden cardiac deaths, even in young individuals, far more than the West, we are 3 times more prone than the whites, Americans, or Caucasians, 5 times more than Chinese, and 20 times more than Japanese to have heart attacks. And that heart attacks in some patients may present as sudden cardiac death, or what we call a cardiac arrest. So we have a variety of causes, but the emphasis, and I think we need to emphasize not just the cause, the sad part of this death, Shreya, is the fact that it has happened in the middle of a lot of other students, from what the reports say, that there were others around. And one of the sad aspects of this, and KK, if you recall, which happened in the lobby, is that such lives can actually be saved. And what we're missing is equally not just information about heart attack, that some of those heart attacks can be sudden cardiac arrest, but the fact that some of these lives can be saved if only people around such people who passed away knew basic cardiac resuscitation, basic life support, and were able to institute that life support. Nearly 50% of those lives can be saved. So I think they lead to a very important discussion.
Dr. Ashok,
not just about the causes and being frightened about the causes, but also right investigations and finally, what is the responsibility of bystanders who are around such a sudden collapse, and that we have ability to save their lives only if we took a greater interest.
Okay, that's a fair point.
Basic CPR.
That's a fair point, that there are many lives that can be saved. Doctor, one of the questions that I've been asked to ask you by our viewers is this: how do I know? Is a sudden heart attack, a sudden cardiac arrest actually sudden? Are there some signs I need to look out for? And how do I ensure that I know that I'm predisposed to a heart condition? How do I know? What are the signs I need to watch out for?
So clearly, this was a young individual. In such young individuals, one is unlikely to have engaging signs of a heart problem. But, the other examples you mentioned, and we've had young individuals of 40, 45, and celebrities, which which all of us know, will have had cardiac arrest. In those, it's very clear. We need to have a family history. So family history of sudden cardiac death at an early age in either of the parents, or heart attacks in our parents at an early age, which we say male less than 60, females less than 55, and females less than 65, is a very important factor in passing down the same disease process. Secondly, those who get diabetes at a young age, those who get hypertension at a young age, heavy smokers with a family history are predisposed to heart attacks multiple times. And these risk factors multiply, not add up. So if there's a family history of a heart attack or sudden cardiac arrest, followed by early diabetes and then smoking, that increases by 20 times the chances of a heart attack. So in these patients, we say early checkup. Checkup starts early. And the checkup doesn't mean exhaustive, expensive tests. All it means is understand and know your risk factors so that precautions can be taken. For example, high blood pressure is asymptomatic. It can affect a young individual and not be noticed till it was too late and had affected the organs. Just a BP check enables that. Diabetes can get unnoticed, even in young individuals and younger individuals or mid-aged individuals. And again, all just a checkup of a blood sugar. High cholesterol level runs in the family. Parents who have heart attacks at a young age, and when I define that young age, will actually transfer those high lipid levels to their children. And again, checkups of blood sugar, blood lipid profiles at a younger age helps to identify those at high risk. And now I'm talking about cardiac disease. That's an important aspect in this country. And
so the number one thing,
to have the usual checkup for this. But on the other hand, sudden death also needs an echocardiogram.
So, Dr. Seth, I'm out of time.
Even an ECG can identify.
I'm out of time, but one of the but Dr. Seth, the most important thing right now you're telling us is that you need to be completely aware and cognizant of your genetic history. Make an effort to know what your genetic history is. You'll be better at predicting what is coming to you. Dr. Seth, we'll leave it there for the moment. Thank you very much. This was a very instructive conversation. I hope our viewers have taken away something from it. Dr. Ashok Seth, thank you very much for your time.